Hello everyone, welcome back to Grow Mind. Welcome back to the Super 30 series, and today is the day 13 of discussing 30 most important topics for the upcoming FMG exam. Okay, so if at all you are following the series, then you might have the idea of what exactly it is. So one full topic will be discussing all the things related to that. Okay, so today's topic is the contraception, and if you go and analyze the past years, then one question from the contraception surely will be there, because it comes in the PSM, then OBG, then the drugs they come under the pharmacology. So mechanism of action, the dosage, all these things is important. So let's have a look at all the things. So I have covered all the points from the contraception in a single PDF, so that you'll be just reading this one PDF and all the points will be cleared. So Pearl index, so a PYQ, I exactly don't remember which year. I think some 2018 also it was asked, and some 2017 or 19 also it was asked in the FMG. So Pearl index, the definition of the Pearl index, what does it stands for and what does it says? So it says about the contraceptive failure of the contraception, and for different contraceptive methods there are different Pearl indexes given, the percentage value. So we will you need to remember that also, because those were also asked in the exam. Okay, so the definition stands for like total number of the accidental pregnancies divided by the total months of exposure into the 1200. So remember this formula. Then there are various methods of the contraception, so we will have a look at each of them now. So the first one is the combined oral contraceptive pills. So combined oral contraceptive, in the sense two content are there, the estrogen and the progesterone. So if you have an idea of the menstrual cycle, it is mainly based on the two hormones, that is the estrogen and the progesterone. So we'll not go much detail into all those things, because we will be just discussing the overview of the contraceptive. So it will be a quick recall or a quick revision kind of a session, so that will brush up your memory related to that टॉपिक. सो estrogen and progesterone है, तो estrogen का काम है, estrogen, what does it do? It causes the proliferation of the endometrium, and the progesterone, withdrawal of the progesterone, will be causing bleeding and it will be causing menses. So this is the basic idea which you must remember. So according to it, see, the combined oral contraceptive pills are designated in a way that the dosage which will be provided, that will be giving from the outside, and that will be very little amount, and this will be causing an ovulation. An ovulation in the sense artificial periods. Actual ovulation will not be occurring, because it is a method which we are handling it, and we are just giving the progesterone 30 microgram, which is just needed for the proliferation, and it will not cause what the ovulation. So an ovulation, and if there is no ovulation only, then there cannot be pregnancy. Okay, so an ovulation, it causes artificial periods. And the Pearl index, so what all I've written the percentage and highlighted it, that is the Pearl index, and Pearl index for this one is 0.5 to 0.6%. So this is the image of the contraceptive pill Mala N, which is a combination of estrogen and progesterone, and this is the dosage. So mechanism of action, you know that it is an ovulation. So frequently questions are asked on the risk factor and the causes of risk associated with the oral contraceptive pill. So important one, this one. So it increases the risk of the breast cancer, cervical cancer, and hepatocellular carcinoma. Hepatocellular carcinoma, how? Because it undergoes in the liver में क्या होता है, what the metabolism, the breakdown of the estrogen happens in the liver, so it might cause hepatocellular carcinoma. Then it decreases the cancer of the ovary and the endometrium, because very few amount of estrogen is released, and very few amount of estrogen will be causing proliferation. So yes, these are the risk factors associated with it. Then moving on to the next, that it's a progesterone only pills, so contains only progesterone, and the examples are the disonorgestrel. These are the chemical brand name. Okay, Saheli and the disonorgestrel, and this is the Pearl index, it is 1 to 2%. Then moving on to the IUDs. IUDs, famous question, asked multiple time, like in all the exam you can expect one question from this IUDs. So the mechanism of action is it gives a foreign body like foreign body like effect, and a septic inflammation will be caused. Like, see, if this is the uterus and the copper T is there here, so uterus will think that some foreign body is implanted, and it will try to act like a foreign body, and it will squeeze the uterus, which will be like squeezing of the uterus, continuous contraction will be happening, by which the implantation will not be occurring, implantation of the embryo. And another important thing associated with this IUDs is nowadays the third generation, these are having the hormonal, so containing the progesterone. So what is the function of the progesterone? Progesterone will not cause ovulation, and it will what like same like this POPs, progesterone combined pills, the mechanism of action will be similar to it. The hormonal contraceptives are of much importance use nowadays. So we look at the generations. The first generation lipis loop not used nowadays, because lipis loop has a risk of causing perforation, so that's why it is outdated and doesn't used. So this is the image, and image based questions was asked, I think in the 2020 and 2022, I think the image was given, and in the recent exam also 2024 Jan, I guess. So this session, this exam was given, this image was given, and it was asking which what is the device given in the uh, following. So it is the combined oral contraceptive pill. So this is the copper T. This image is also important, and this one is the Mirena progesterone containing. These both are the, this one is the Mirena, and this is quite famously used nowadays in India, and this one is also the hormonal containing the progesterone. Okay, so these were the images. Mug up these images because it is very important. Then copper T, the questions asked on the copper T are like the duration of the span. So it is used for 10 years, and this is the Pearl index. But we nowadays do not use copper T also much. Nowadays these only are preferred. Sorry guys, I had got a call. So where I was, third generation we were discussing, right? Third generation is the progesterone, the hormone containing, and the Pearl index for this one 0.2 percent. And see, this is the least like what least associated with the failure, so this is preferred. Then the Progestasert, it can be used for the 18 months, and this is the uh, total amount of progesterone present in it, and this is released per day. So microgram, this amount of progesterone is released per day. So then another is the Mirena, which is the levonorgestrel, and it is valid for the 5 years, and this is the amount of the progesterone, and 2 microgram per day is released. Okay, the progesterone is released from this one. So this is about the IUDs. बहुत ज़्यादा इंपॉर्टेंट टॉपिक है, must know. And another important point from this one asked multiple times is, in the postpartum females, what is the proper time to put the insert the IUD, and it is within the 48 hours, because like after the delivery the uterus will be still the abdominal organ. So when it is an abdominal organ, it's very easy for us to put this IUD, so that's why it is preferred in the postpartum. And also questions are asked like, which is the best contraceptive method in the postpartum females. So we'll have a discussion over that also, that which is best for which condition. Okay, then see, yes, another important topic is the contraindications of the IUDs. So asked multiple time, and first of all this one, unexplained vagina, and this PID. So they will be describing a clinical case, and they will be describing like a female, or they can just seriously ask us direct questions like which all of the following are contraindications for the IUD insertion except करके भी दे सकते हैं. Okay, so these are the conditions where IUD is contraindicated. In case of unexplained vaginal bleeding, because it might be due to some cancer, also cervical cancer or endometrial cancer. So if there is no exact cause of the vaginal bleeding known, then we will not be inserting IUDs. And the question asked on the IUDs is also like, one of the thing, most common symptom of the IUD is the bleeding. So it will be causing bleeding, and second most is the pain. So remember this one also. So clinical case was asked on this also, that a female was inserted IUDs 5 days back and now complains with the bleeding. So what is the next management? So management step is reassure the patient and send her back, because bleeding in the first few days will be happening, but the after some days it will become a regular cycle, and bleeding will not be seen, and pain also will not be there. Okay, so most common symptom is the bleeding, second most common is the pain, remember this one. Then puerperal sepsis, because this is also an infection, and in case of PID also, this is not inserted, because it becomes a foreign body, right? So it is like we are again inviting infections in the genital tract. So in case of any kind of infection, we will be avoiding it. Distorted uterine cavity, like sometimes in case of the septate or bicarbonate uterus and all those things, the uterine anomalies in that, and in case of pregnancy. So these are the absolute contraindications. Now let's discuss about the implants. So implants are the subdermal implants which are inserted here under the arm, and they also will be releasing the progesterone, the hormone. And examples are the Norplant 1, 2 and implant. Not that much important, but I think image based question was asked on this implant. They had given the image and they had asked what type of contraceptive it is. So it is the implant. Then a shear ring. So the a shear ring, see here, these are the rings, and these are put here around the junction of the fallopian tube and the uterine cavity, so that it will be causing the fibrosis of the tube and blockage of the tube. Okay, so this is the mechanism of action, and this is a PYQ. A question was asked on that. They had given this image and they had asked the mechanism of action of this kind of contraception, or they can just give the image and they can ask what kind of contraceptive it is. So it is the Escher ring. Then moving on to the vaginal ring. So this is the image of the vaginal ring, and vaginal ring, contents of the vaginal ring, PYQ, and this is the dosage. Then vaginal sponge, this is a must know topic, like PYQ was asked that vaginal sponge contains a spermicidal. So what is the name of the spermicide, or what is the content of this sponge, vaginal sponge? So it is the nonoxynil 9. Okay, so remember this name, it is an important one, nonoxynil 9. Then this is the image. So image based question can also be asked. Then the another method of the contraceptive is the barriers, which are the condoms, and they are having the highest failure rate. So this is the Pearl index, and see 14 to 15%. So highest failure rate is seen by these barriers, and these barriers, these are the male condoms and these are the female condoms. So male condoms will be having one ring and females having two rings. Okay, so yes, this is about the barriers. Then moving on to the next, that is the injection progesterone. So progesterone available in two forms. First one is the DMPA, DAMPA, and this is the amount, dosage कितना देंगे हम, and this is given for 3 months. Per 3 months it is given, and once it is given it will be valid for 3 months. Okay, progesterone, and this net EN given for 200 mg for 2 months. Okay, so this is about the injections, not used that commonly, but still, like, as it is important from the exam point of view, so you must know about it. Then IRWA patch. Sorry for the disturbance, guys. The IRWA patch also contains hormones, estradiol and norelgestromin, and this is the dosage. Then moving on to the next contraceptive, that is the sterilization, which is a surgical method, and it can be done two types: vasectomy done in the males and tubectomy done in the females. So vasectomy has this failure rate of 0.1, and the important question asked on this post vasectomy is this, that after the post vasectomy, मतलब after vasectomy करने के बाद में, how much amount, like what is duration for which a person should maintain other contraceptive? It is the 3 months, because see, let me explain to you. This is the where testes are, like testes is the location where the sperms are formed. So it happens that sperms are stored in the this epididymis, then stored in the vas deferens, comes in the vas deferens, stored here, and then they come out. So until 3 months, which are already formed, pre-formed, can be accumulated in the vas deferens, and they can be coming out in the ejaculation. So that's why for 3 months or 12 to 16 weeks, we need to practice barrier contraceptive method, so that to avoid the conception. Okay, so this is the important question. Then tubectomy, the site of the tubectomy is the isthmus, and there are various methods for the tubectomy. First one is this Irving's, and in Irving's you can see here that the fallopian tube is cut, and this part is put down into the uterus itself. Okay, so there is blockade occurring here, so there will be no contact of the egg and the sperm. This is the most commonly performed technique, most commonly used technique, the Pomeroy's, then Parkland, and this is the Meadowland, and this is the coiponous fimrectomy, removing of the fimbria only. So these are the sterilization methods available. Now let's have a look at the emergency contraception, because this is also important one. Questions have been asked, clinical cases have been asked, like a female comes with the unprotected intercourse at this time, like they can give 24 hours or 72 hours. So what is the method used? So based on the time period being given in the question, you need to choose the correct option. So let's look at the definition of the emergency contraception. Contraception within 72 hours of unprotected intercourse, that is called as the emergency contraception. Then the most commonly available technique and most commonly preferred is the levonorgestrel, that is the progesterone, because progesterone we take and we stop, it causes withdrawal and removal of these conception. So 1.5 mg tablet one time, and this is also considered as the drug of choice because it is available easily, and to take also it is very easy, just a pill, put it in the mouth, and then over the counter it is available in all the pharmacies, like no prescription is needed for this one. Okay, so easy to use and easily available, so that's why it is considered as the drug of choice. Then contraceptive pills, these are taken under the USP regimen, and 2 tablets morning 100 gram, then 2 tablets a microgram, and 2 second tablet in the evening 100 grams. So this is after the contraception. After the contraception, one in the morning, one in the evening. So this is not used nowadays, outdated. This USP regime is outdated. Then another one is this mifepristone. So mifepristone, this is the dosage 25 to 50 mg. This is also called as a RU486, and it can be taken up to 72 hours of unprotected intercourse. 72 hours in the sense like 5 days, up to 5 days also it can work. 3 days, 70 to 36, yes, 3 days, 3 days it can work. Then IUDs are effective up to 5 days, and ulipristal acetate, it is a selective progesterone receptor modulator, and the dosage is 30 microgram one tablet. So these are the emergency contraception. This one is very important one, and this IUD is very important. Okay. Then contraceptive of choices. So various conditions we will be using different kind of contraceptives. So let's have a look at that also. In case of a newly married couple, we'll be giving COCPs. We'll be advising them to have a COCP. If there is any heart disease, no COCPs, and combined oral contraceptive pills are contraindicated. Note down this one. Then in case of diabetes, IUDs or COCPs, whichever is suitable according to the person. Then in case of uncontrolled diabetes mellitus, barrier plus spermicide. STDs, barrier, obviously barrier. Then in case of vesicular mole, combined oral contraceptive pills, IUDs are contraindicated because it will act like a foreign body will be putting again, then it might cause an infection and bleeding also, so that is avoided, IUDs. Then if a couple is staying in different cities, then it is an IUD. And lactation is very important one. POPs, progesterone only pills, asked multiple times. This question PYQ was asked, like 2019 में पूछा गया है, 2020 में पूछा गया है, ठीक है. तो लैक्टेशन के टाइम पे progesterone only pills are given. Then after more than 6 weeks of delivery, then IUD is suggested or preferred, and in case of sickle cell anemia, progesterone only pills. So these were some contraception of choices. So all the questions related to the contraceptives have been discussed here, and everything you must know from the contraceptives. So all the best for the exam, and for the PDF, join the Telegram channel. Like the video, share it with your friends, and subscribe to GrowMed if you're new to GrowMed. I am Dr. Padmini, your mentor for the FMGE. Thank you so much once again, guys. Bye bye.